Many of you recognize the title of my talk as at least an overblown statement, if not an outright falsehood, perhaps designed to titillate or be provocative, guilty as charged. I think what I want to do is start with a more simple proposition that where you live matters a good deal for your physical health, for your psychological health, for your life chances, for your personal prosperity. Neighborhoods matter, place matters. We know, for example, about blue zones, these few distinctive places around the world where people live extraordinary long and healthful lives. In fact, they forget to die. There's a budding zip code literature in sociology and public health documenting how life chances differ across zip codes, and that zip codes are indeed 5 digits of separation. The zip code as destiny argument is actually part of a larger class of arguments called neighborhood effects. This literature has exploded over the last 25 years, leading policymakers to focus on so-called geographies of opportunity. It's produced work suggesting that neighborhood effects, delinquency, school performance, health, poverty, joblessness, travel behavior, even voting behavior. The studies behind all of these arguments certainly are compelling, but there's common sense behind all of this too that tells us that place matters, that constant exposure to violence and dangerous environments might lead to elevated anxiety that could in turn produce physical responses. Our understanding of the causal mechanisms are pretty clear in some cases, not so clear in others. Urban form is what facilitates certain different types of travel behavior, but sometimes the mechanisms are more obscure. It's, if not completely unknown. Is delinquency, for example, affected by the company you keep, by contagion effects, by socialization, or by the lack of role models? And at the same time, we have difficulty quantifying the exact scale and the degree of important neighborhood effects for several reasons. The first is that it's not at all clear that some of these relationships are causal, or causal in the direction that we anticipate. Is it truly the urban form that produces different travel behaviors, or do people who like to walk move to places where it's easy to walk? And if it's not self-sorting, might there be another selection process occurring? Might the same variables that are associated with poverty, joblessness, or poor health, such as education, human capital stock, might those be the sorting factors that lead people to move to one place or another? And might those be the factors that are the true determinants of the outcomes that we attribute to neighborhoods? And while we have fancy methodological techniques to control for observable characteristics, we really do wonder whether neighborhood effects really exist. Because those techniques can control for observable characteristics that might sort us, but they don't say much about the unobservables that sort people. So in fact, we're not that sure about neighborhood effects and about what we think we know about neighborhood effects. To be exact, we're unsure about the dosage. What length of exposure is sufficient to trigger neighborhood effects? How long does one need to be in an opportunity neighborhood to experience its benefits? Likewise, we are unsure of the relevant thresholds. Just how advantaged does a zip code need to be to bestow its benefits upon us? Conversely, how bad does a neighborhood have to be to damage one's life chances? We're sure, I think, on the two extremes, but in the middle, we're not at all sure. Finally, even without reservations about the existence, the importance, and the dynamics of neighborhood effects, we don't know what to do about them. There are, in the first place, issues of scale. We can't move everyone to a blue zone. We can't even move everyone to neighborhoods of opportunity. Second, if we could, should we? We've been trying to move people to better zip codes for the better part of the last 2.5 decades, and the results haven't been all that good. And what do we do if they don't want to move to those neighborhoods that we think are better for them? And what do people give up in terms of social support networks, security, place attachment, if they are moved in this way? Should we instead focus on improving places? How durable and stubborn is neighborhood disadvantage? Can we move the dial on that? And how can we improve neighborhoods for the benefit of incumbent residents, rather than simply trigger processes of gentrification that move poor people from one place to another? Neighborhood effects is an intriguing and in some ways appealing idea, but it's a long way from understanding that place matters to using that insight to design interventions to help people. So in the meantime, keep your phone number of your doctor. Thank you.